Well, moms out there, if you've given birth and maybe you nursed for a year or two, well, chances are your breasts aren't exactly what you want them to be or what they used to be, and that's kind of a common thing. We're finding out that breast augmentation and surgery is one of the more common cosmetic procedures. But how do you know which one is right for you? Well, Dr. Jason Leedy is here to help us sort through the facts, and I was telling you what a friend said to me. I said, well, maybe an implant would fill everything back up again, and he said that would be like a tennis ball in a tube sock, and you said you guys just call it a rock in a sock.
That's what can happen. There's a lot of things that can happen to the breast over time. And sometimes women are just born with a chest that they're unhappy with. Either there's not enough volume, there's significant asymmetry, or the breasts just happen to sag. But there's surgeries that can be performed to correct that. More often than not, there's people that have had kids, they've nursed, they've lost weight, or they just found as they've gotten older that their breasts have changed in a way that they're unhappy with. There's two main surgeries that can help change that and restore a youthful shape to the breast, namely breast augmentation and breast lift, or mastopexy is a technical term.
And I didn't know augmentation basically means an implant. I thought that was an umbrella term for any surgery, but it's an actual implant.
Correct.
Yeah, okay,
correct.
So probably not for the mom who nursed for 2 years.
Well, it may be okay. It really depends on the characteristics of the breast. Now, some women, they nurse and they actually end up smaller afterwards than they were before they became pregnant. And the breast tissue can actually shrink, atrophy. That's someone that may just benefit from an implant. And there's a lot of women like that, the actual nipple and areolar complex, the pigmented part of the breast, is in a decent position. It's essentially at the level of the breast fold. If that's the case, and they're just missing some volume, then an implant can often restore the shape. It can fill out that skin envelope. But what happens in, I'd say, a greater number of people is that the skin is stretched and the nipple areolar complex actually drops below the level of the fold. When that happens, an implant alone will not correct it. An implant will only make the breast larger. The only way to...
And heavier, probably,
and heavier,
too.
yeah. And cause it to droop some more. The only way to actually lift it is to do the breast lift.
And that's a little more complicated, right? Because that involves some more cutting. Like what?
It is.
Yeah.
The breast augmentation surgery generally involves a smaller incision, around 4 centimeters or so. Recovery is measured in a couple days. Most people can get back to work. Now, a breast lift, though, the incisions are much longer. There's always a scar that goes around the areola. And I guess the important thing here is that there is no one breast lift surgery. The amount of scarring depends on the amount of lift that's necessary. So but there's always a scar around the areola. That's called the circumareolar lift. Then you can have what's called a lollipop lift, or lollipop type incision, with an incision around the areola and then the one that goes down to the fold. But if there's more skin, then you need what's called an anchor type incision, around the areola to the fold and then side to side, and underneath the breast fold. And that allows the most skin to be removed, the most reshaping of the breast to be performed.
And the bottom line is you have to weigh the difference. Yes, you're willing to put up with scars for a 24-hour better look, as you go about your day, right?
Correct.
Yeah.
Yes. Yeah, you trade one. There's no way to do it without the scarring, and that's the one downside to the breast lift. But most people find that the scarring is a reasonable trade-off, and it's something that they're willing to accept in order to achieve a nicer shape.
And bottom line, only your doctor knows for sure which
Correct.
is the best. So Dr. Jason Leedy, thank you so much. And truly, best idea is go and sit and talk and discuss those options, because you never know which is the right for you. Well, if you want to contact Dr. Jason Leedy, you can contact him at the Cleveland Plastic Surgery Institute in Mayfield Heights. The number is 440-461-6100. You can also go to Dr. Leedy, LEEDY.com, or of course goodcompanyshow.com. So thank you so much,
Thanks
Doctor.
for having me.
Yeah, now we know. And now